What is a frozen shoulder? Well, in a layman's term, when the shoulder is frozen, we call it frozen shoulder. But what does that really mean? The ball and socket in a regular shoulder joint lives in a capsule. What's a capsule? It's a room in which the ball interacts with the socket, around which the rotator cuff works, around which the inside of the cartilage, which is called the labrum, works. So when this ball has to move on the socket, and I'll show you an example with my hand, the ball needs some freedom in the socket, because as we know, the shoulder is a 360-degree motion joint that no other joint in the human body brings with it. But when this ball tends to get adhesed, tends to get stuck, tends to get frozen to the socket for many reasons, we call it a frozen shoulder. Typically, and not always, women tend to get it more than men, especially in their menopausal time years, or for example, a patient who has not been exercising, for example, and suddenly becomes a weekend warrior, makes the shoulder inflamed, makes the shoulder angry, and then technically or medically we call this condition adhesive capsulitis. What does that mean? Adhesive just means stuck, and capsulitis means the capsule, the room in which the shoulder was living in, is inflamed. Itis means inflamed. So adhesive capsulitis, a frozen shoulder, means the shoulder, the ball, the socket are stuck to each other. Any medical condition in our profession needs to have figured out why the condition happened in the first place. So for example, if a patient comes to me and we diagnose them having a frozen shoulder, but the reason behind the frozen shoulder was because they tore their rotator cuff and they were in a lot of pain, and as a result they couldn't move their shoulder, and now they got frozen. So that's, we call it secondary frozen shoulder to let's say a rotator cuff tendon tear in this condition. Osteoarthritis can do that. Sports injuries can do that. Diagnose a frozen shoulder and go after that reason, and then we'll fix the frozen shoulder. And if that means physical therapy, injections, time, pain medication, means anti-inflammatory medication, or for that matter, if it means surgery, we will encounter that. If you have any questions about frozen shoulder, please call and schedule a consult with Carolina Regional Orthopedics.